So, all right, hey guys, this is Holly. So she's one of our prenatal patients. So I'm gonna walk you guys through an adjustment for a patient like this. So can I have you stand up first? So these tables are unique in the fact that we can open up this little piece here. So I'm gonna open that up. Holly, can I have you lay face down here? Your hips are just gonna lay right off of this. Head's gonna be down there, okay? So we can adjust this piece. Is this comfortable for you? Mm-hmm. Okay, we can raise and lower that depending on the comfortability for the patient. So with prenatal, the primary objective is to work on some of the ligaments that attach from the pelvis and sacrum, which are the hip bones and then the tailbone, into the uterus or the womb, okay? Because we want to kind of just allow for the fetus as they're developing and growing to rotate as they should during development. So first thing I'm going to check is I'm just going to bring her legs up. And this technique that we primarily use is called the Webster technique. And Holly's pretty flexible. Does one side feel a little bit more tight or restrictive than the other?
The left, maybe.
Left side? Okay. So from here, okay, a little restriction on her left SI joint here, her sacroiliac joint. So I'm just going to kind of palpate around, feel for any kind of swelling. Compared to the right, it's a little bit more what's called posterior or pushed back. So I'm going to work on a muscle called her piriformis. That's a muscle deep inside of her glutes here. Is this tender here, Holly? Mm-hmm. Okay. So I'm just going to kind of work on this, stretching it out. A lot of times when baby is developing and mom's growing a little bit, bones are separating because the ligaments which hold the bones together, those are starting to get stretched out and long, so her muscles tend to take over and they get a little bit tight. So we want to make sure that we kind of stretch some of those muscles out, because we also want to provide a little bit of mobility so that mom doesn't have quite as much pain when she's sitting or even walking. It's a little tender down here, isn't it? Okay, next what I'm going to do is work on a ligament called her sacrotuberous ligament. So Holly, I'm going to have to press my thumb a little bit close to your hamstring and glute here, okay? And I'm just going to stretch this. This may or may not be super tight or tender on the patient, but it's good to kind of get this loosened up because this ligament attaches to the womb. And if it's taut, it can sometimes contort the position of the womb, and so baby can't really turn as he or she should. This is not quite as tender as the other side, is it?
No.
Okay, good. Good, and that's much looser. Okay. Same thing, we do want to do a full spine adjustment to clear out any kind of misalignments of her spine. So I'm just going to feel her upper back here. And when Holly came in first, she was dealing with a shoulder issue that's been since cleared up, but it's always good to check her upper back here, because as a mom, already she has a lot of stress on her spine. Good. Okay. And then what I usually like to do to help clear out that SI joint as well is I like to put them on side posture and adjust them that way. So can you face me this way? I'm going to drop this table down. Good, I'm going to have you straighten this leg out here. Good. Right there. Now for prenatal, I don't like to do a whole lot of rotation in the spine. So I'm just going to kind of rotate her hips forward a little bit, keeping her lumbar spine pretty neutral, her low back. I'm going to push right through her SI joint here. Good. Can you go on your back for me? Next, I want to clear out her neck. Good. A little bit tender up here on the right side. Okay, so upper cervical here. So with this, I'm not going to do so much rotation as I am just going to kind of push down the facet joints. So a little push. Good. And that cleared nicely. And then a little bit lower on this left side. Good. Excellent, so that balanced her out. Next, I'm going to check what are called her round ligaments. So they kind of sit right in the angle of her hips here. So what I usually like to do is just palpate from side to side and feel which one is a little bit more restrictive. Now she had a little bit more on her left side, on the back, and that kind of matches in the front. So I'm going to stand on the same side here. Is this a little tender right there on this left side? Okay. So I'm going to kind of go with the patient's tolerance level. Let me know if that's too much. I'm just going to sustain contact here. So the importance of the round ligament is that it comes off of her pelvis and attaches into her womb as well. And so if this is, again, tight, just like that sacrotuberous ligament on the back, it can sometimes just misshape that, and I can already feel a little movement relaxing. It misshapes the womb. Is that tenderness starting to go away?
It's better.
Good. Have you been having any pubic pain? You have? Okay.
Yeah.
So I'm going to palpate your pubic symphysis, okay? Is one side more tender than the other? Left side here, right? Okay. So everything's matching on the left. So for this adjustment, this is going to be super light. So again, I'm going to use the arthrostim here. So I'm going to use my thumb to kind of barricade between the pubic symphysis and the arthrostim here. And I'm going to angle it downward. Doing okay? Good. Good. And then what I want to do is recheck her. Good. And then I just do some light palpation to make sure the round ligaments. I'm going to hold this for a few more seconds, okay? And Miss Holly here is fairly early in her pregnancy, so when they're this early, I'm okay with assisting them sitting straight up after the adjustment. When they start getting a little bit further and it starts getting more uncomfortable for them to sit straight up, what I'll usually have them do is lay on their side and assist them up that way, just so it does not undo a lot of the work that we just did. Good, that's feeling a lot better. Excellent. Go ahead and grab my hand, I'm gonna help you up. Good, and then face that way. And again, I just like to do palpation of the neck in the seated position just to make sure that everything is holding firm after the adjustment. Good. Awesome. Good job. Stay right there for me though. Place your hands by your hips here. Turn your thumbs around the other way so that you're not mad at Frank. Push your elbows back at me. Good. And let's do this one over here. Push back here. Good. How's your shoulder been feeling, by the way?
Much better.
Awesome. You're not just saying that for the camera, are you? Awesome.